This Good to Go segment is sponsored by Corewell Health.
You can rest assured that what's happening inside the walls at Corewell Health is being done with the best interests of patients in mind. Take, for example, the genetic link that may accompany some cancer diagnoses. Corewell Health has an oncology collaboration team that allows physicians and genetic counselors to work together on the most complex cases. Dr. Caleb Bupp is a medical geneticist here to help us understand this critical work and the impact it has on patients and families. Hi, Dr. Bupp.
Hello, how are you?
I am well. Thank you for being here. Now, this is complicated, but it is super important. First, can you tell me about medical genetics? What does a geneticist do? What does that mean?
So a genetics physician is somebody who sees patients who either have genetic conditions, so things that we're born with in our genetic code that cause health issues like Down syndrome. We also see people who have health issues, and maybe it's because of something in their genetic code. And we go looking for that sort of answer of why, so that we can know what to do about it. And then we also see patients who have a family history of something or thinking about having kids. And wondering what about my genetics might inform my own health, both now and into the future.
So Corewell Health has developed this oncology collaboration team based on this idea that genetics play a role in some cancers and that there's a benefit in doctors and geneticists collaborating to figure out some super complicated cases. Do I have that right?
It is always better to work together.
Yes. So tell me how you do that.
Well, in the genetics world, we're always finding new things. We're understanding things in a new way. It's a very cutting edge field. We're each individually unique in our genetics. We have 20,000 genes. We have billions of genetic nucleotides. So we're really complicated. And it just takes one change in your genetic code to cause a genetic condition and also to trigger cancer. And so cancer really leads the way in understanding our genetics informs the treatment that we give so that we give the right treatment to the right patient at the right time.
Ultimately, you do this work to help the patient and their family, of course, because when you talk genetics, it impacts way more than the one, I'm guessing.
Yes.
So talk a little bit about the impact that this work is having on patients and families.
Well, when someone is diagnosed with cancer, or when someone has someone in their family that's diagnosed with cancer, why? We hear things, breast cancer, lung cancer, but what was the actual cause? And a lot of times now we can find that gene, we can find that change, and then say, well, what does that mean? And then how do we treat that? So when it comes to developing treatment plans for patients, but also how about prevention plans, right? If someone has a change in one of the breast cancer genes, BRCA1 and 2, we know they're at much higher risk. So they should have things done earlier to screen and to be ready. And the same thing applies to our family. So our genetic code gets passed down from parents to kids, grandparents down. And so we know other people can be at risk. So a patient becomes a family very, very quickly in genetics.
So I know that Corewell Health is committed to making healthcare more simple and affordable. Is this collaboration achieving that for the folks that you come in contact with?
This gives us the opportunity to have more people that we can bounce ideas off of. We can say, have you seen a case like this before? What do you think? How do you read the evidence around this? Because with genetics, it's impossible for any one provider to know everything. So we really start to rely on those teams and those collaborative teams to really help each other and to form the big picture so that patients get that comprehensive care that's right for them personally.
And what about outcomes? What are you seeing?
It's good stuff. It always warms my heart as a geneticist when I run into something and I say, I've never seen this before. And then you go and you talk to somebody in your field and they say, I have, and this is what I thought about, and this is what we did. And you're like, oh my word, thank you so much. This is how medicine should happen, right? We should be knowing where our limits are, knowing who our teams are, and then working together to get those better outcomes for patients.
Well, as I said, it's complicated, it's fascinating, and it is so, so important, the work that's being done there. So thank you, Dr. Bupp, for taking a few minutes with us.
No problem. Thank you.